Hi, Ms. Stone. So my name is Chelsea. I'm a physician assistant student that's working with Dr. West, the neuropsychiatrist here in the inpatient psychiatric unit. So I wanted to go ahead and just give you a little bit more education on all the information that we were able to go through and tell you a little bit more information about the diagnosis that, we're going to go ahead and give you. So I'm really sorry, first of all, for everything that you've been going through emotionally over the past year, and especially over the last several months. Your family and your friends are happy that you're safe and that you're still here. And my job and the job of our team in the inpatient psych unit is to keep you safe and, make you feel better. So as you mentioned, you came into the ED for attempting suicide. You told us that you were having a lot of high and low alternating mood swings. Your roommate did witness you trying to use that kitchen utility knife. And thankfully, nothing, we were able to avoid, a bad occurrence from escalating. And you are being treated for that superficial wrist laceration. And after reviewing all your symptoms that you've said you've been experiencing over a year, they fit the criteria, the DSM criteria, which is the diagnostic. So the DSM criteria, it stands for the Diagnostic Statistical Manual of Mental Disorders. So it's what we use in psych. And it all qualifies you for major depressive disorder or just depression, as you've probably have heard. And in order for you to be diagnosed with major depressive disorder, you have to have at least 5 symptoms or more for a period of 2 weeks or more. And as you mentioned, you've been having decreased energy, interest, you've had poor concentration, the suicidal ideations that led to the attempted suicide, as well as your feelings of worthlessness. So all these symptoms have been going on for, about 6 months to a year, as you mentioned. And I know you said that they had a lot to do with your financial instability, not being able to secure that full-time job, and also the loss of your father, which I know is very difficult. But, I just wanted to know that there's definitely something that we can do to help you and make you feel better. So we have these drugs called antidepressants. You've probably heard of them as SSRIs. So they're called selective serotonin reuptake inhibitors. All a fancy word for just saying they're a medication that we use for depression. The one that we're going to go ahead and send you home with and have you take while you're here the next 3 to 4 days is called fluoxetine. It's also called Prozac. That's the brand name. So you're going to start taking this daily. And while we have you here 3 to 4 days, just monitoring if you have any other suicidal ideations. I know you said you don't have any at the moment. We're going to also, have you go with a case manager so we can set up some outpatient treatment. So we want you to speak to a psychiatrist as soon as you get discharged. And we want you to take this medication. You'll start seeing improvements around 2 to 3 weeks. And in reality, the full medication effects you'll start feeling around 4 to 6 weeks. So this is a great option for you. This, along with something that we call psychotherapy, is also, where you're going to see the most amount of benefits. You're just going to feel so much better if you're taking this medication. And then you're also doing therapy. We recommend cognitive behavioral therapy, CBT. So this has shown, if you do medication and CBT, the highest rates of remission. So basically saying that you're going to be able to combat those depressive thoughts. And we did also want to let you know that the panic attacks will also, although they're stable now, that medication can also help if you have panic attacks in the future. So your asthma and your allergies are stable. Continue to get those monitored by your PCP. I did want to let you know that you're never alone, and we want to help you, your families and friends. So if you ever do have thoughts of suicide, don't hesitate to call the National Suicide Prevention Line or 911. We just want to make sure that you're not in any danger to yourself or that you don't hurt anyone that you love. Do you have any questions for me? Okay, if you do, please let the nurse know. Both me and her are willing to answer anything you have. I hope you feel better. We're going to go ahead and send those referrals for that outpatient care and hope you feel better. And I hope I don't have to see you anytime soon. Thank you.